So we utilise the family partnership model, and that's a relationship-based model. We are based within the early help service, and I think the benefits of that are that even though we come under the social care umbrella, children's services, we're seen as less threatening. We operate in terms of under like a solution-focused, strength-based support, and that's holistic with our social care colleagues as well. And what we do is recognise pregnancy brings a hope and positivity. So particularly on that pre-birth programme, it provides a window of change, which is often a motivator for parents to make that change. The key in terms of engaging our parents is building a relationship with them, but having in mind utilising a trauma-informed approach. And what we do is, even though we have a programme of delivery, we have to recognise that actually each of those parents are unique, and that we may have to adapt the programme slightly because we're trauma-informed. What we look at is we see parents' past behaviours and understanding them and that trauma around that. So that might be trauma they've experienced themselves in childhood, but also it might be around the last set of proceedings, because with having a child removed, there is trauma and loss associated with that. So they may have had negative experiences around social care, either in their childhood or around the last set of proceedings. So what we might support them with is looking at emotional regulation. Often their responses, because of the trauma they've experienced, that those responses are negative. So what we look at is we try to help them to reframe their responses. It's not about coaching them and what they need to say in terms of getting through assessments or in child protection meetings, but it's helping them to understand the role of social care, and in particular around that pre-birth process, understanding what happened in previous removals and then why social care or other agencies may have been concerned, and looking at then how they can overcome some of those difficulties. We offer an assertive outreach programme, and demonstrating that practitioners are needs-led, and that those practitioners in particular are consistent and empathic with parents.